Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc, and welcome to another episode of FAQs, or foot and ankle questions. Today's topic is ingrown nails. So our first question, what is an ingrown nail? Well, it's a dimension problem. If you have a size 6 toe and a size 9 nail, the skin's not going to be happy about that. Typically, big toenail is going to be between 1 and 1.4 centimeters in width. If it gets much wider than that, the skin is going to form a battle between the skin and the nail. Why does it occur? Why does it get wide? Well, there's 4 reasons. Genetics, your family trait for this, they can give you wide nails. Sometimes you can't run away from your family tree. Trauma can widen the nail. It doesn't have to be one big hit like a soup can dropping in your foot. It can be repetitive trauma, such as soccer or a dress shoe. It slowly changes where the nail grows. Age will change it. The older we get, the more the nail matrix will change and get wider. And also fungus infection, onychomycosis, can change the nail and get really thick, as well as change the shape. We're not going to deal with that with these series. We're going to save that for another episode of FAQs though. This is a very slow changing problem. It doesn't happen all at once. It takes a long time. It occurs in many episodes. It's much like a parent and a teenager. The parent gets irritated by the teenager, again, irritated to a point where it doesn't take anymore, then explodes. And that's what the skin will do with the nail. We'll see repeat type of performances before it becomes really angry. The skin is very, very good about accommodation to a point, and then it hits its limits. What does an ingrown nail look like? Well, typically I would warn people to look away at these pictures, but if you're looking at this, you probably have something very similar, so it shouldn't be too upsetting. When the nail's too wide, which is our first picture, you're going to see a marking on the margin of the nail. That's actually how wide the nail is. It's a lot different than what the nail appears, so it's not always what it looks like. It's kind of the tip of the iceberg. The next, the nail can grow inward. It can curve downward, called an incurvated nail. This nail will continue to change its shape and continue curving until it forms a complete circle. That looks painful, it sounds painful, and it is, but it's absolutely amazing how well the body will behave itself until it doesn't do it anymore. And the third picture is a combination of both. This is an example how the soft tissue will react to the nail. It will swell around there and try to wall it off. It doesn't do a very good job. Actually, this was a visible nail you could see, which was 1.5 centimeters, which you don't see. When the nail was removed, it was almost 3 centimeters wide, twice as the amount of nail that you see in that area. What does an infected nail look like? Well, if you go back to that, think back to that picture you just saw, it had a lot more redness to it, drainage coming out of it. That's an infected nail. An inflamed nail is the next step before you get to an infected nail, and that previous picture looks very much like an infected nail, except not quite as much drainage in that area. The danger with an infected nail is the distance the nail and the infection is between bone. If you took the nail bed, and the bone, if you stacked about 10 pieces of paper on top of each other, that's about the thickness of the skin between there, and it doesn't take much for that nail to cut into that or that infection to erode. And if it touches bone and we get a bone infection, we have something as simple as an ingrown nail, now creating a loss of a toe or an amputation. It doesn't take much to jump from the frying pan into the fire. And most people tell me that, geez, I sterilize my instruments when I treat my nail. They treat it themselves. Well, it's not the instrument that causes the infection. It's the nail. Think of that foot's in a shoe, in a sock. It's getting perspiration, bacteria and fungus are all over it. So it's not the instruments, it's the nail, the fungus around there, the bacteria that create the infection. So beware of that. That's why that causes such, it's a dirty area. That's why it causes so many problems. How do you treat an ingrown nail? Well, we have temporary and permanent options. The temporary option is what we usually use for our older geriatric patients that have multiple health problems that maybe can't tolerate a nail procedure. We also use it for a first-time occurrence where it's marginal. It may not be that wide of a nail, and we want to give it the benefit of the doubt. We take out a small portion of the nail. Not even local anesthetic is required for this. It will reoccur. It takes about 2 to 4 months for the nail to grow out from the base to the bottom for it to cause problems again, but it does give us temporary relief, and it's more of a maintenance type of treatment. If we want to prevent this from becoming a rerun where it happens over and over again, we take out that border, that lane of nail, so it never comes back. Highly successful procedure. It's about a 98% success rate. Make sure you go to somebody that does this frequently. Somebody that doesn't do it frequently, emergency rooms, etc., aren't going to have the success rate, and they're going to have a higher reoccurrence as well as a complication rate with that. Okay, somebody's been observing well. The next question is, what is this figurine behind me? Well, this is a Christmas ornament from the Christmas Story, my second favorite Christmas movie of all time. My first one being It's a Wonderful Life. And this is from a scene where they double dog dared the character to put his tongue on a flagpole. It got stuck, and this is my reminder to use good judgment and never get double dog dared to anything that would cause problems. Okay, how do you cut an ingrown nail? Well, you don't want to cut it past the skin. Remember that nail is much wider than what you can see, and when you cut underneath the skin, you're in no man's land. And you can also take out a nail fragment, but leave a fragment portion in there that looks like a spike or spicule, and it's going to cause problems from you. Bathroom surgeons create more pain for themselves than they need to go through. They also give me more business than I really need. So don't cut where you can't see. Probably the easiest and best thing to do is cut the nail straight across. That's good for normal nails, but on a nail that's slightly wider, if you take an emery board or a file and round off that right angle on the edges, that won't push into the skin as much and give us a little bit of relief for a short period of time. How do you care for an infected nail? Well, if you go to a primary care physician or an urgent care, most likely they're going to use an antibiotic. And that's really good for treating the infection. But remember, there's a cause for this. So think of it as a thorn in my side. If the skin's really angry, it gets infected. The antibiotic will help the infection, but guess what? The cause is still there. I have people coming to my office under 3 episodes of antibiotics. They're wondering why it still reoccurs. Well, the nail's still there, and that needs to be addressed. So what we do is we remove that nail. It calms everything down. How long does it take to heal from an ingrown nail? That really depends on how far the nail grows down, and they can be exceptional. We want that to heal is from the bottom up. If it doesn't and heals from the side and there's still drainage coming out, that can boost problems. Generally, within a week and a half to 2 weeks for a border, you're back to being normal and dry. If it's a total nail, that may take anywhere from 2 to 3 weeks to heal up. So it doesn't stop activity, which is our next question. When can I return to activity after the nail procedure, nail border removal? Well, with a nail border, I have my runners back the next day. Really no restrictions of activity. And the same is true for a total nail. Usually walking is not a problem afterwards. Runners, I may take anywhere from a day to 3 to 4 days off, but there's usually not a whole bunch of limitations with that. So if you want to read more about the myths of ingrown nails and how to treat them, I've got a blog on my webpage appropriately titled Nailing It. Take a look at that. If you want to find out some more information about The Wonderful Life and be entertained, why Clark Gable refused the lead role, why a little glitch in the copyright law made this our most loved and beloved holiday movie ever when it was sitting collecting dust. Take a listen to Mike Rowe. He's got a YouTube section called The Way I Heard It, and he talks about it. I think the section is called Francisco's Folly. If you listen to that, I think you'll be exceptionally entertained. I hope I answered your questions about ingrown nails. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.